Hi, so my name is Ros Musa. I'm a contact lens optician and I wear two hats professionally. So I'm professional affairs and manager for the Body Doctor and also work in clinic fitting contact lenses and running a dry eye clinic simultaneously. So as I'm looking at your eyes at the moment, what I can see is there's loads of debris and almost like wax built up on the base of your lashes, and it's supposed to be there. So we're going to do this procedure called ZEST. And what that is it's an ochre-based solution. It's non-toxic. It's very similar, if you think about it, it's very similar to going to your hygienist, but this is going to make things a lot more comfortable. So you can see the kit in front of you. Make sure you have everything laid out as you can see it. Make sure you have all your packets open. Make sure you have your wells ready. I would actually prepare and put some ZEST solution, your magic pot, split it evenly between the two wells. Close the side that you're not using so you don't have any confusion. Make sure your wands are out, open your saline, and have some scissors if you need, just in case you need to use them for opening anything up. Before you do the procedure, obviously hand hygiene is really important, so do wash your hands thoroughly. You do have the option of wearing gloves if you wish. As you can see in the pack of ZEST, there is a mask just so you're protecting them and yourself and you're not passing anything on to the next patient. The reason we want to prepare the area before we use the ZEST is we don't want anything that's on the skin to interact with the ZEST because it just affects the efficacy of it. So what these wipes do is they clean away any moisturiser, little bits of makeup that may be left, because we do want the patient to come in makeup free if possible. We want to make sure that any sunscreen, anything like that, is all cleaned away, and that makes the ZEST work really well and stops any irritation that may occur. The best thing to do is get them to tip their head back so it's against the headrest and they can't move anywhere. Tip the chin up and make sure that they look down towards their knees. The most important thing is that the patient feels comfortable. As you can see, I'm really loading the ZEST solution onto the wand. You can see it's quite gloopy, and you're going to paste that onto the eye as if it's like a bad paint job from a child at a playgroup. So you want it everywhere, and then you're going to agitate by going backwards and forwards and in circle motions, and it's like shampoo. When it starts to froth, that's when you get the action. And now I'm going to go through the lashes as if it's like a mascara wand, so really helping those glands of mole and Zeiss and pulling all the debris down the lash and really cleaning them up. Going to avert the lid now slightly and go along that meibomian gland openings, because you want to kind of clean along there and break that biofilm down there as well. You can blink and get the patient to blink and allow this to go onto the front surface of the eye, because we want some of that anti-inflammatory on the front surface of the eye. We want that action on the front surface of the eye, and we're going to repeat exactly the same process on the lower lid as well. I'm going to stop halfway through and just make sure that the patient is comfortable and happy, and have a look down the slit lamp to make sure that we're actually cleaning away well. My advice is don't work in silence and try and continue a conversation about how well this procedure is going ahead. So when you're checking down the slit lamp, you will see the base of the lash starting to look cleaner. You will see the hair disappearing into the skin underneath that froth, and you will see that you've broken down a lot of that biofilm. So as long as you're happy, then you can rinse away, or you can actually go back and do some more. As long as we're happy now, we can come back and wash away with the saline and irrigate the front surface of the eye. So as we're cleaning away, you can use the drape that you see all the products placed out on to protect the clothing if you wish, or you can just, which is what I do, is actually just use the gauze and hold it underneath the eye and use your saline to just rinse away and irrigate the eye. And now we're good to go on the second eye. Okay, so we have washed away our ZEST, we've dried the area. Now what we want to do is inspect the area. So you do an ocular examination. You'll probably find that the eyes are looking a little bit whiter, that the lid margins are looking a lot cleaner, the meibomian glands express well, and that tear prism height is looking a lot more normal. So we know that the procedure has worked really well and the patient is a lot more comfortable. Now we just think about what we want to do to give them as home management to uphold how well ZEST has worked. So as you can see, this kit is now being completely used, and you can completely fold it all up and just put it all in the bin, clean the area, wash your hands, wipe down your slit lamp, and you're good to go for your next patient.